Ted, with the pulse ox monitoring, the physicians in my area have been talking about the fact that if somebody has normal, quote unquote, saturations and they're evaluated in the emergency room, that they may be then sent home. And I had asked a question similar to what Marit asked you about potentially using pulse oximetry at home as a way of monitoring. And ultimately, I'm building up to a point of asking you your opinion as to what you would do and or whether you would do anything differently now in this new knowledge of how COVID is affecting us, that they would ultimately advise their patients that if they saw a 4% drop or more, that would be a reason to potentially come back to the emergency room. So let's say they left and they were at 95. Now, if they're going to be able to monitor it at home, that if they're 91 or lower consistently, not necessarily as a one-time measurement, that would potentially be an indication that there's an issue going on and they should come back to the emergency room. Do you agree with that? Is that changing at all?
Well, so if somebody has a normal pulse oximetry measurement in the emergency department and they generally kind of look okay and their lab, whatever evaluation you do looks okay, yes, I think that's reasonable to send them home. And before COVID-19, we wouldn't even tell somebody to monitor their pulse oximetry at home, or even if they had a pneumonia, we'd say, okay, go home and let us know, if you're consistently having fevers or you're not feeling well, or all these, if things aren't going in the right direction, let us know, and we wouldn't be monitoring their pulse oximetry. So the one question becomes, at what point do you think about having somebody actually start to do that? Or do you base it on, tell us if you get short of breath? Now the question, so that's somebody with a normal, pulse oximetry measurement in the ER. The question is, what do you do if you have somebody who's at 91, 92, even 90 or lower? Can you send them home? And traditionally, there's no way we as physicians would have sent somebody home, if they didn't have if they had pre-existing lung disease like COPD and already were low, and we had that documented that they just live around 90, that's a different situation. But
sure,
somebody otherwise who's 60, 65 years old and is at 90%, they get hospitalized, 99 times out of 100 because we're nervous about which way they're going to go. The question with COVID-19 is, which of those patients can you safely send home? And what if you have somebody who's sitting in front of you at 82%, where they, if that were a pneumonia, we'd be thinking about intubating them. What do you do with somebody who's sitting there, not short of breath, feeling fine, just muscle aches, maybe some fevers or headache, but you have this number there in front of you that makes all of us as physicians take a deep breath and start to react. What do you do with them? And all this data too, we're all dealing with just a couple weeks old data and we don't really know what to do with it.
Sure.
But the question is, yes, if you can keep somebody out of the hospital, then you have fewer hospital related infections. They can go quarantine at home. So that's going to be a real determination, is who can you take care of at home, and what number of drop on that pulse ox matters. Is it 2%? Is it 4%, 6%? I think that 4 is somewhat arbitrary, but probably rooted in it sounds like a reasonable number.
So I got a quick question.
Really interesting thing to think about. And besides that number, we have to think about, can we monitor their heart rate? Because like I said, if that goes up, that's probably something to react to. Can we monitor them remotely and have a video that they, just a streaming video where they come by every hour or two and say, hey, I'm still feeling okay. Because that actually may be telling us as much or more than this oxygen saturation is doing. Should we be monitoring their temperature as well and use that as a marker? And the answer is probably yes to all of these things, and we just have to figure out how to use the data.
Right.